Hi, I'm Alana Hippensteel from Pharmacy Times. Before we get started, one of our top articles today discusses the negative consequences the initial phase of the COVID-19 lockdown has had on individuals' habits, including their sleep and exercise routines. There's more of that on pharmacytimes.com. Today, I'm speaking with Amanda Epp, the CEO of ScriptDrop, on how the COVID-19 pandemic has affected consumer behavior trends in the switch to digital prescription fulfillment and the need to grant pharmacists provider status in order to support the healthcare system in the fight against COVID-19. So, Amanda, how has the COVID-19 pandemic affected prescription fulfillment in the industry?
Yes. So overall, it felt like this shift happened overnight because pharmacists had to figure out a way to safely get prescriptions in the hands of their patients when they couldn't go to the pharmacy or didn't want to go to the pharmacy due to COVID-19. So that battle that, pharmacy chains and even independents have had with foot traffic and the need to see their patients had to evolve really quickly. So pharmacies needed to embrace some resilient and reliable way to connect their patients with medications through delivery.
Yeah, absolutely. How have consumer behavior trends changed since the onset of the pandemic, perhaps beyond just the switch to digital?
Yeah, well, first I would say I think the biggest shifts in script drop has always been in prescription delivery.
Yeah,
We looked at the Google Trends from last year, and no consumer was looking for how to get their medications delivered.
right.
It's not a popular search whatsoever. And then fast forward to amidst the pandemic, that's one of the most popular searches is how can I get my prescription delivered?
Right.
So it started to shift. Consumers are, demanding it, and they know that it's an option now instead of having to go to the pharmacy. So we've really started to see that change and evolve. When we actually launched ScriptDrop last year, average patient age was in the 70s. And really what it felt like overnight too is our patient age is down to in the 60s.
Yeah.
I think it is because, the younger generations have realized, oh, I can get everything delivered. I should get my prescriptions delivered too.
Right.
Um, so
Yeah.
we've definitely seen a lot of changes throughout these last few months.
Right. Yeah, absolutely. Um, has the switch to digital prescription fulfillment had any unexpected effects on pharmacies and the pharmaceutical industry?
Yeah, so first, I think it's important to clarify that ScriptDrop ourselves, we're not an actual digital pharmacy. Our approach is very different. Instead of becoming this dispensing pharmacy where we ask, patients to transfer their script to us, and then we would figure out how to get it to them as quickly as possible, which oftentimes when you're doing something like that with a dispensing pharmacy, that can still be days or even weeks with some of these digital pharmacies, where if you're a patient that you need an antibiotic or an acute med, or you're going out of town and need something really quickly, that's just not an option. So what we do is we work with pharmacies. We work with independent and chain pharmacies to give them a platform to offer delivery to all of their patients
Yeah.
in a lot of different service levels. So I do think that the digital pharmacy space too has grown immensely, where patients are looking for different alternatives now on how to get any medication delivered.
Right.
It's still really important to have your local pharmacy who you understand. You usually have that relationship with the pharmacist. Pharmacies or pharmacists are one of the most accessible healthcare professionals. So why not empower your retail chain and independents of the world to plug in prescription delivery to their operations in a seamless way that
Mhm.
doesn't add more administrative complexities, which they already have enough of in the pharmacy space.
Yeah, absolutely. Yeah. How might consumer behavior preferences continue to be impacted by the COVID-19 pandemic in the future?
Yes, so we do see that consumers are going to continue to demand prescription delivery
Yeah.
and likely start to demand, different service levels too. Like some patients might be okay with it coming in a couple days, others might need it in that 1 to 2 hour time frame.
Right.
And Script Drop's mission too is, we know that yes, patients may have every intent after they leave the doctor's office to go to the pharmacy,
Mhm.
but life gets in the way, and something may come up. So being able to offer prescription delivery throughout the patient journey, at different touch points, making sure that it's accessible to them, I think is really critical, and just allows the pharmacist then too, since we partner with pharmacies, to be involved in more areas along that patient journey.
Yeah. Yeah. Um, how would granting pharmacists provider status help the country fight COVID-19?
Yes. So a couple things that would do. Provider status, what that means too is, pharmacies can offer the vaccination, which some states, are definitely doing, as well as be able to change medications. Just having more insight into what is going on with the patient care, I
Yeah.
think is really critical, especially in amidst a different time where COVID-19 is unfamiliar to everyone. So I think the more information that our healthcare professionals have to work with, and more tools to collaborate, and interoperability has never been more important than right now.
Yeah.
I do think provider status will be really impactful in patient care, and making sure we're doing what's best for the patient.
Yeah. Yeah. Um, how could granting provider status to pharmacists also help the country better manage the current provider shortage, which I understand is expected to worsen over the next 15 years?
Yes. So when you think about pharmacists having that provider status, you likely eliminate some of those what would have been physician office visits. And actually, right now, yes, the provider shortage is going to happen in the next few years,
Mm.
but we're also feeling it right now, since providers are in such a demand, that it's almost like Script Drop. I feel like our where we're at as a company accelerated 2 years beyond where we ever thought.
Mm.
And it's sort of doing the same with providers. I mean, it definitely is speeding up the demand to figure out provider shortage much faster
Yeah.
than I think we would have imagined. But if you imagine, not having to go to your physician's office to change a medication, to get a vaccination, anything like that, to eliminate the number of visits that a pharmacist could take on,
Yeah.
and be able to administer, and take care of the patient, and communicate that back to the provider, I think is really impactful.
Yeah. Yeah. Um, what are some common misunderstandings around what would change if pharmacists are granted provider status?
I think probably the most common misunderstanding is, providers or pharmacists interfering at all with patient care, being more opinionated, maybe making it more complicated.
Yeah.
But I think, uh, not knowing the whys or whats, or having more vagueness or unknown, actually hurts both parties making decisions. So really understanding the true detail and what they're working with, and sharing the patient record, again, back to that interoperability. I think that is key. It's only perceived that it will worsen. I think it will actually make things better.
Yeah. Yeah. Absolutely. Yeah. Um, what are some other key issues that granting provider status for pharmacists can ultimately help to fix within the healthcare system?
So I think with provider status, being able to give vaccines, switch medications, you're eliminating the doctor visit. But pharmacists go to school for exactly this: how medications interact, what needs to be prescribed. So making sure that they're leveraged in the patient care plan even more than they are today, I think is really important. And back to, they are the most accessible. It's, really 92% of pharmacies are within 5 miles of the patient.
Yeah.
So it's much more accessible than having to go to your doctor, schedule an appointment. And again, it's hard to get into your doctor because there is a shortage.
Mm.
where really truly making sure that the pharmacist is more accessible, we're communicating with them more and leveraging their knowledge
Yeah.
is really important in healthcare.
Yeah. Yeah. Absolutely. Um, what is the value of the pharmacist in supporting the healthcare system in the fight against the COVID-19 pandemic?
Oh, I gotta think about this one a little bit too. um, because it's a little bit of my last answer, I think.
Okay.
But I mean, definitely the value in the COVID-19 pandemic is, again, over 90% of pharmacies are within 5 miles of the patient. So
Yeah.
when you also think about um, vaccinations and making sure that we are staying on top of patient care,
Yeah.
they're more accessible. They're actually a more trusted profession, where I think that they could be leveraged even more amidst such a critical time for us and in healthcare.
Sure. Absolutely. Absolutely. Yeah. Um, thank you so much for taking the time to speak with me today, Amanda. Now let's hear from some of our other MJH Life Sciences brands on their latest headlines.